Homocysteine. This is an amino acid that your body produces when it breaks down protein. Above 15 is considered elevated, and it's associated with heart disease and stroke and cognitive decline. Worth knowing. But a quick, honest piece. Major randomized controlled trials showed that lowering homocysteine with B vitamin supplements didn't really reduce cardiovascular events. The marker is real, but the pill approach doesn't seem to completely work. I'm not saying that it's useless, and maybe you shouldn't be on some methylated vitamins, but you really should be focusing on fixing the underlying lifestyle issues and then seeing what those numbers look like after that.